I believe I have time for a couple of questions or comments or reactions. Yes.
Thank you for those really inspiring and focusing remarks. We talk about this as a social movement. And what I'm wondering is that if you can comment, from the civil rights movement, you were talking about history as to whether you think we can actually make a sustainable social movement take place in order to do this.
Young people have led all of our movements, and they are leading this one. Now, it happens that these tragedies have brought to light the pattern of the use of lethal force against unarmed young people of color. And so you have a moment of organization and activism on the part of young people today that I haven't seen before. But not just young people, the people marching in the streets of New York were of all races, all ages, all socioeconomic groups, and they were saying this is not acceptable, this is wrong. But like any other movement, you probably had a decade of activities going on quietly before things burst to the surface. And I think that's what's happened here. But what we have to do is connect the dots. There's the movement for environmental justice and sustainability. There should be a movement for optimal health conditions in communities. There's a movement for racial and justice. There's a movement to overcome these vast economic divides that we're expanding toward economic equality. But they all center around creating conditions in which people can live and realize their dreams of health, well-being, and perhaps even prosperity. So we have to leverage today's information technology, and it's here at levels it's never existed before, I believe, to pull us together and coalesce around this goal. And I believe there's a critical leadership role for the public health community, because ultimately, these are matters of life and death. And they're also huge matters of economic investment and, unfortunately, disinvestment. But thank you. So I'm optimistic. I used to say to people, this won't happen in my lifetime. And the young people challenged me, and they said, why do you say that? And I said, well, I know these things take time. And they said, unacceptable. So they formed their own organization, which is called Within Our Lifetime. And their commitment as young people in their 20s and 30s is to end racism within their lifetimes. You can actually go to their website and you can take the unconscious bias tests, implicit bias tests, and they are doing very good work. So I am optimistic, but it will be the young people that lead us for sure. Do we have time for one more question or comment? Now don't be shy. Yes. Could you stand and they'll bring you a mic?
Hi, thank you so much. That was a wonderful talk. We have to work through, if we want to make a living, through organizations.
Yes.
And I was just wondering if you have any thoughts about organizations here in Washington that are thinking the way you are and doing the kind of work that you would want.
Now, if you hadn't added here in Washington, I had a whole list of organizations.
Okay, go for it.
No, just kidding. There are many organizations that are working on these issues, and I would encourage you to visit our website at the W.K. Kellogg Foundation. We also fund all the major civil rights organizations, and we have asked them to work together and to collaborate. And because our approach to this is not, it's about the belief system. So we work with Native American, with Asian American, Pacific Islander, Native Hawaiian, with Arab American, with African American, with Latino and Hispanic communities, with Appalachian white communities. This idea is not a polarizing approach. It doesn't have to be. It can be about focusing on our collective humanity and recognizing that this is a legacy belief that has no place in the 21st century. And so almost all of the major civil rights organizations that we've been funding and working with for the last 8 years are definitely thinking in this way and moving in this way and standing up together. If someone's temple is bombed, they all stand up and recognize that's like bombing any of our churches. That's denying our freedom. So we do take an approach to this work that we have found is not polarizing and it is not divisive. In fact, it is calling forth our better selves, and we're feeling pretty good about that. But I would suggest the NAACP, the Urban League, the National Council of La Raza, the Asian American Pacific Islander Native Hawaiian Health Forum, almost all of the major civil rights organizations are moving, not just dealing with the symptoms, but with the underlying beliefs. And the implicit association test, you know, you can Google that and take it. It comes out of Harvard University. There, you know, everything is controversial to some degree, but it's a powerful experience to take it and to get in touch with your own patterns of responding and thinking, and then hold yourself accountable for questioning your automatic responses. And we're funding people who are working with over 50 police departments all over this country that are taking law enforcement officers through these same types of processes and deepening their understandings. So it is work that can be done. It doesn't have to be a Twitter storm that shuts down the conversation. It's real work. And the public health community, I believe, should play a lead role in getting that work done. Yes.
I guess the advantages of dismantling that type of thinking is clear, but my question is, what do you think is the incentive for people who would like to continue or perpetuate that type of thinking?
Well, I had to say to a friend of mine who was followed by a police officer recently, and he was angry and upset and all those things, and I had to say, don't let that momentary exposure to ignorance. So the incentive, I've come to the understanding that the incentive on an individual basis is ignorance. When we talk about collective and or group incentives for continuing to adhere to that belief system, I would call it arrested development. I think as this is about human development, and as we develop as human beings, we become more aware of our connection to other human beings, and we let go of those beliefs that divide us from one another. And so whether it's ignorance or a lack of development, and this is a developmental process. You don't wake up tomorrow and overcome racism, you know. This is a process. So I attribute it to that. Now, there are financial incentives to keep things as they are, the status quo, and that's a different conversation. That's the structural piece, and that's where the mobilization and the work is required. It's not an either or in terms of how we do this. We have to continue to protest and to strategize and to legally attack those structures. But doing that alone will not heal this nation. We have to work on both changing the hearts and the minds, and as Mahatma Gandhi said, the souls of the people. Because otherwise we will have what we have today, which is, even though we had Brown versus the Board of Education and a Supreme Court decision to integrate the schools today are more segregated than they were then. And so it is a both and. But I don't think we've ever really had a concerted effort to uproot this belief system, to acknowledge it, and to say it has no place in our country. And I believe that's an important part of overcoming disparities, of creating healthy and safe communities, and indeed creating a culture of health. I think there was one final, yes.
Is this on? You talked a little bit earlier about the public health community playing a leadership role in this effort, and you talked a little bit about the importance of the medical community as well. Could you talk a little bit more about what the public health community is doing and what their unique role is in this activity, and a little bit more about activities that are happening with the medical community? And I'm from the American Academy of Family Physicians, so just my sort of disclosure.
I bet you could tell me what's going on with that group.
No,
You
I
want to
don't.
tell us what's going on with them? No?
I know what I'm doing. But,
Okay, well, tell us what you're doing.
I mean, we're not involved in this, but I know that I have a specific interest in the issue of violence and trauma and how it impacts people across the lifespan. But I've only been working with the family physicians for 6 months, so
Okay. Well,
I haven't
thank
had a
you for
chance to do
sharing.
much
Thank you.
yet.
Yeah.
But
So-
I am interested in what organizations like ours and others can do.
So I didn't mean to make light of the life course perspective, because that is an important breakthrough concept that people are galvanizing around. And not only, childhood adversity, but also optimizing birth outcomes. So we've been very concerned about making sure that maternal health is ideal, if we can make it that way, and providing the supports, the psychological, emotional, and real tangible supports that minimize stress and the allostatic load during the pregnancy experience, and improving birth weights and birth outcomes. And not, we focus on infant mortality, but what we really need to be focusing on is optimal birth outcomes, so that we have ideal weights. And one of the ways that we can help in the very earliest phases of life is to really improve breastfeeding rates. There is so much that happens there that not only protects the child, but also protects the mother. I mean, I read an article from Europe recently where women who had breastfed exclusively actually had a decreased risk for retinal degeneration. Now, I'm trying to figure out what are the mechanisms, what are the pathways biologically that offer so much protection for both the mother and the child. But clearly, we do have some public health leadership. We have a real movement now to create baby-friendly hospitals all over this country as part of the obesity reduction effort. And if we could make sure that every child born really did get access to mother's milk exclusively, if we could just close the disparity gaps, that's a major component of mitigating the effects of adversity that they might be exposed to, of helping them to develop the social connection, the emotional resilience that is required in lives of adversity. So that's one area. This movement in our country now to increase access to early childhood development and early childhood education. This is, again, another important work. It's not public health work, which you asked, but it is public. It is the public's health work. And so making sure that whatever community you live in, and you do the opportunity mapping, and you ask yourselves, are the most vulnerable children getting access to these resources that are absolutely required for optimal development in the early phase of life? Making sure that our communities are safe. Now, there's a movement for safe communities and reducing violence and taking a public health approach to violence. I hope the public health community really steps up in that space, because that is, I think, where we are perhaps the most vulnerable as a nation. There is simply, and certainly the poor are the most vulnerable, because there's just too much killing and dying. That's another space where the other area where we don't have a good convergence, we have leadership in the public health community around the quality of housing and healthy homes, but we don't have leadership around an affordable housing policy and access to housing in neighborhoods of opportunity. So we need to rethink our nation's approach to housing as a factor in terms of health and well-being, and I think the public health community could do more there. And then finally, this income inequality and this struggle for living wages, that is being led by many groups around the country. I don't see the health voice right there at that table in ways that it could be. But a living wage is a necessary component of a healthy life in our consumer-driven society. And so those are frontiers that are waiting for, I believe, the public health voice to be more organized and more present in partnership. Partnership is hard work, and that's the other challenge. But you're going to have an amazing panel come up and talk about these and other things, and we'll get more into the complexity of this work. Public health today is a very complex system. We spent the 20th century building it, and now the 21st century is asking us to, what's the term, to upgrade? 2.0 or 3.0 or something. But I think we will, and I think America requires that we do it. And so globally, that's the case as well. But I applaud the leadership of the American Public Health Association to put out that challenge that we would not only move up in our grade, but we could actually become the healthiest nation. We are the wealthiest at this point. Surely we could be the healthiest nation. Thank you.